The mission of the Ministry of Health is to develop and implement policies and programs and undertake other actions to deliver effective, efficient, quality and affordable health services. The Federal Ministry of Health is always in the news, but unfortunately, more often for the wrong reasons. Strikes and threats of same, rivalry among health sector professionals, lack of equipment, and so forth tend to overshadow the progress being made by the Federal Ministry of Health to improve Nigeria's health indicators. Professor C.O. Onyebuchi Chukwu has been the man in the hot seat as the Minister of Health since 2010, and he joins me on View from the Top today. Thank you, Honorable Minister, for agreeing to speak with me.
Thank you very much.
And I thank you for joining us. Before I launch into my conversation with the Minister of Health, here are a few things I'd like you to know about him. Honorable Minister, current health indicators such as infant and maternal mortality, life expectancy, and routine immunization are still pretty low. Yet the ministry expends so much energy on all these crises in the health sector. Isn't it sad that some less endowed countries are doing better than Nigeria in these areas?
I think it's all about relativity. I wouldn't say that everything is pretty low. Take, for instance, the numbers we've been posting all these years came from the 2008 National Demographic and Health Survey. Now, this is a major survey that will carry out every 5 years. So what it means is that before 2008, we actually had one conducted in 2003. And just last year, 2013, we just rounded up conducting one, and we're now validating the data. But a survey that was done by the National Bureau of Statistics, along with the Office of the Senior Special Assistant to Mr. President on MDGs, done in 2012, showed some progress. For instance, maternal mortality ratio fell from 545 per 100,000 of 2008 to 350 per 100,000 of 2012. You take something like under 5 mortality rate, that was reduced from 157 per 1,000 going by 2008 figures to 94 per 1,000 going by 2012 figures. So yes, we may not be there, but if you look at the trend, I think we're not doing too badly. If you analyze what we've done since the beginning of the millennium in terms of maternal health, we've actually been able to reduce maternal mortality ratio by as much as 56%. Now, the target was to reduce it by 75%, but 56% is no mean achievement. And then if you look at immunization coverage, for the first time in the last 2 decades, and I repeat, for the records are there to check, for the first time in the last 2 decades, we have hit more than 80% in terms of immunization coverage. Now, this is administrative data for immunization, and we're going to carry out direct field survey this quarter. But even from the administrative coverage, we've come a long way. And if for the first time in more than 2 decades, we're hitting more than 80%, actually 83% to be exact, I don't think we're doing badly. But why have we had general problems with health indices in Nigeria, like you asked? Again, I think part of the reasons has to do, one, with our federal system. I think Nigerians lived so long under military regime that it's only now they are beginning to understand how federal system ought to work. We still have local government councils together with their chairmen, and I suspect many of them who were born during the military era are still waiting for the federal government to come and intervene in everything. Many states are doing well now, I must tell you, as Minister of Health. I'm very proud of those states doing well, but there are also states that may not also have been doing as much as expected. And because of that, there's a limit to what the federal government can drive. Health is supposed to be on the concurrent list. I say supposed to be because presently it's nowhere in our constitution, but it's supposed to be on the concurrent list going by our 1979 constitution. And if health is on the concurrent list, it means that responsibility is shared between the federal government and state government as well as the local governments. Now, many state governments ought to pay more attention to things that will impact directly on their citizenry. For instance, education, health, sanitation, environmental sanitation, and stuff like that. But unfortunately, because of politics, sometimes they want to compete with the federal government in terms of those bigger infrastructural things that ought to be left more in the hands of the federal government. So that is one of the reasons, I suppose, why we're not doing too well. Because even going by what people are touting as our national averages, they remain what they are, national averages. Even as I'm happy that we've gone down to 350 maternal deaths per 100,000 live births. It's an average. That means some states, if you go to some states, the figure is much more lower. But also means that some states might actually be having as much as 800, and it's true. We do know some states, particularly in some regions, that are not pulling their weight so much. And so even when we are trying to intervene, we try to concentrate in those areas that actually have the more difficult task of meeting the Millennium Development Goals.
It's been alleged that there's an absence of a regulatory environment for practice in the health sector. What needs to happen?
Or the regulatory environment is not as effective as we should be. Actually, that is one problem we're trying to solve with the national bill that is before the National Assembly. Actually, the individual health professional, whether they be they doctors, nurses, pharmacists, laboratory scientists, dental technologists, and so on and so forth, are regulated at the federal level. So we have professional regulatory bodies, 13 of them, that address squarely the requirements for individual practitioner. But when it comes to licensing centers, institutions such as hospitals, this is presently being done by the states. So for instance, all hospitals in the Federal Capital Territory are licensed by the equivalent of the state, that is the Federal Capital Territory Administration. But if you go to the states, even where we have federal government-owned hospitals, they're actually being licensed by the states. Now, some states have begun to reorganize their regulatory agencies. Some states are doing far better than others, but they're in the far minority. So very few states, I'm not even sure up to 5 states, have been able to really get down to work to know that it is not a mere administrative exercise to license a health institution. For every health facility, the states need to go through, inspect them, and ensure that minimum requirements are met. So I think because it's being left to the states, that's why there has been a bit of weakness, because the states are also complaining that they may not have the resources to do the carry out the regulatory function effectively.
Why is there this apparent rivalry among the diverse professional groups which tend to affect negatively the delivery of services in the health sector?
Well, maybe because they are very handsome and very beautiful, so it's all about beauty pageant. Actually, I think this started coming off from when many of the other professionals, besides the medical professionals, the doctors, started acquiring additional qualification. Their numbers started increasing. And naturally, many of them were also thinking of where they should be. And I think the thing also stemmed from the general problem we have. We think there's still need for a lot of counseling to be done in secondary schools to be able to mentor our young students, especially when they're about to leave secondary school to go to higher institutions to pursue professional courses. Many times when people apply to JAMB, I think the students do not quite understand what those courses are, where it will take them. And they may have had lofty dreams about what they wanted to be. So there's need to probably counsel them, and